Well, as we do every Tuesday morning, it is now time to check in with infectious diseases specialist, Dr. Isaac Bogoch. Good morning, Dr. Bogoch. It's been a while. Good to see you. I thought we'd start by revisiting COVID-19 vaccines. We actually have a viewer who is due for her next vaccine who wants to know if there's a new COVID vaccine coming this spring/summer and whether or not she should hold off until it becomes available. What do you suggest?
Well, a couple things. For starters, just a good reminder that, of course, COVID has never gone away. It transmits year round, and sometimes the year we see more of it, other times the year we see less of it. The National Advisory Committee on Immunization, so that's sort of the Canada's advisory body, has revamped its COVID-19 vaccine recommendations. And really this is turning into, for the vast majority of people, not everybody, but for the vast majority of people, a vaccine that would be administered in the fall around the same time as the influenza vaccine. And really, they kind of divide their recommendations into, should get vaccinated and may get vaccinated. And in the should get vaccinated crowd are really people who have risk factors for severe disease, so infection that could cause hospitalization and death. And typically that really includes people who are on the older end of the spectrum and people who have underlying medical conditions that put them at greater risk for this severe disease. So that's a long-winded way of saying this is individualized medical care, and this is something that people should be asking their family physician about. Of course, we know not everyone has access to a family physician, so this is something you can talk to a pharmacist, a nurse practitioner, a family physician, a public health expert about to really get nuanced, tailored advice to the individual. But in general, these vaccines will be updated and provided in the fall.
In the fall. Okay, that's good to know. And, I remember a time when we were talking about COVID-19 not too long ago, how there were new variants popping up after Omicron. I think I've lost track of the numbers and the alphabets of the various variants. But where are we in terms of COVID-19 and its, I guess, lethalness and transmissibility? Are there more dangerous variants popping up? How close of attention are we paying to this right now?
So while the general public may not be following this as closely as they once were 5 years ago and 4 and 3 years ago, behind the scenes in medicine, in public health, and in the world of infectious diseases, of course, this is still being tracked and monitored. The virus is doing exactly what it's been doing since the very beginning. It's changing, it's mutating. There's other variants with, names or letters and numbers bunched together, similar to what we've seen earlier. But really, this is still under that Omicron umbrella that we've been here for years now. But if you take a step back and just sort of look at how is COVID impacting communities now, again, it's not gone. Of course, it's not gone, but it's nowhere even near what it used to be 2, 3, 4 and 5 years ago. I mean, wasn't that long where a single pathogen completely overwhelmed our healthcare system and healthcare systems around the world. And you know what? Now we still see an occasional case of COVID-19 come into hospital. It happens. But it's obviously much more rare now than in the past. People aren't getting as sick in general now compared to the past. But I would remind people that it still can be a very significant infection, especially for those who are on the older end of the spectrum and people who have underlying health conditions that put them at greater risk. Those with underlying heart or lung conditions, those with underlying immunocompromised states, they can still get very, very sick, and they do, from COVID-19. And that's why it's still important especially for those people with risk factors, to be up to date on their vaccinations.
Yeah, definitely still important to pay attention to that, especially if you are in that at-risk or vulnerable category. Dr. Isaac Bogoch, that's our time for this morning. I wanted to get into the long-term effects of measles, but we always have next Tuesday. So thanks for joining us and have a great week. Take care.